Hello, this is on what is a pharmacy benefits manager. Pharmacy benefit manager, PBM, is a third-party administrator for prescription drugs. Um, it's basically the drug portion of your insurance. There's three big companies in this area. You have CVS Caremark, which is now CVS Health. Caremark was the PBM. Um, there's Optum RX, which is owned by United Healthcare, and there is Express Scripts, which is now owned by Cigna. And the way a PBM works is, so you have a PBM, and then say you have a retail pharmacy. And then you have a health plan, union, government, employer. So the PBM, in theory, is negotiating contracts with, they're negotiating contracts with pharmacies on behalf of the health plans. That's the idea. The idea is that they, manage a formulary to reduce costs. They negotiate reimbursements or amounts paid to pharmacies, and their argument is that they save everyone money because they are able to negotiate or get large price concessions. But in reality, they are now bigger than these companies, and because there's only three, they're not really doing it. And these guys are probably okay with that. But there's other players in this game. So you have a pharmaceutical manufacturer. It's supposed to be a factory. Very good one. So you have a manufacturer, and the PBM also negotiates with manufacturers, and they negotiate rebates. Rebates are kickbacks, or I guess I would say that in the law, the PBM's healthcare has a federal anti-kickback exemption. So they negotiate rebates for drugs for the manufacturers to have their drug covered on a formulary that people can then get at a pharmacy. When you go to the pharmacy, if your drug is covered, it's on a formulary. And you also have wholesalers. So the flow of drugs is manufacturer to wholesaler to pharmacy to end user or patient. Then you have the flow of money, which goes this way. Manufacturer pays rebate to PBM. Pharmacy then, when you come in to get your prescription, runs a claim, and theoretically the PBM then reimburses the pharmacy for that claim, and then you have, if there's any co-pays, the patient pays for that. You also have, in theory, a wholesaler buys drugs from a manufacturer and then sells them to pharmacy. The drawing looks really confusing, but I guess in this video the main point is PBMs, pharmacy benefit managers that manage prescription drug benefits. It's a very complicated loop. This drawing is not very clear. I'll try to make more videos that go over this more in depth. because you'll find out there's lots of conflicts of interest. There's not very much transparency with the flow of money, and it doesn't really follow this kind of logical step of, say, a manufacturer makes something, sells it to a wholesaler, wholesaler sells it to a retailer, and retailer sells it to a patient. And a very simple way to look at that is just look at pharmacy benefit managers, look at their maybe historical, these are publicly traded companies, look at their historical earnings, and you'll see like they are very large. They make a lot of money, so how do they make all of that money? They would say, like, just for negotiating a contract with a health plan on behalf of a health plan, they would, generate revenue of 60 or 70 billion dollars or more, which seems pretty excessive to me. Thanks.